Hi, I'm Philip Whalen. Today I will be discussing closing the gap in future primary care shortages in America. Okay, so the purpose of my presentation is to get the US government to provide more funding at college levels to help close the primary care health shortages in America. How I will be doing this is by providing research statistics that have been conducted on this topic, giving health opinions from health professionals like physicians, physician's assistants, nurses, and healthcare administrators that I have talked to and interviewed. Also, I will be presenting ideas that we can do with this funding that can help us close this gap. Okay, from now to 2025, the United States will see an increase in demand in the primary care health professions. This is due to three reasons: rising population, rising aging population, and the debt of medical students coming out of college. According to the Occupational Handbook from 2012 to 2022, there will be an 18% growth within this field. That means there will be an increased demand of physicians, physician's assistants, and nurse practitioners. Also, the medical students coming out with huge debts are picking specialties over the primary care health field, which is hurting us because they feel that they won't be able to pay their debt coming out of college, so that they're going into neurosurgery, surgeons, ENT. So that's the reason why, and this is hurting us. Okay, here are some statistics from the Health Resources and Service Administration, which is also known as the HRSA, found that aging and population growth are projected to account for 81% of the change in demand between 2010 and 2020. Due to this drastic growth, there will be a need of 33,000 primary care physicians for the rising population and 10,000 for the aging population. The HRSA states that the nurse practitioner field will increase by 30%, and for the physician's assistant PA field, 58%. The national average coming out of college medical school for students is $170,000 for all 4 years. So this plays a huge role on what field they want to pick in medicine. And a lot of primary care health fields, you really can't. They feel that they're not going to be able to pay this off. Okay, closing the gap. Throughout the United States, there are a number of areas that are called physician-needed areas. These are areas where they're most needed. Based on this graph, you can tell areas that like Texas, Alabama, Georgia are rural areas where they need physicians. And okay, here are some methods that I've came up with and researched to help close the gap and can help future health professionals. We could start out with student debt repayment programs, community primary care programs for future medical students, grants and scholarships, and more clinics in physician-needed areas. What I came across in my research is that I found that the state of Mississippi, especially at Mississippi State, has a scholarship for their pre-med students that want to go to medical school, and they can get it paid for as long as they're willing to go into the primary care health field. And this is a great thing. This is a way to help close the gap, and we need more programs like this. My conclusion is that this topic needs to be put on the top of our list. It can be closed. This gap can be closed, and we can fix this. My statistics shows that there needs to be a change, and it can start now. And we could start programs from student loan forgiveness to more primary care clinics in needed areas. This problem can be fixed, All we need is to educate and provide more funding on this topic. Thank you, and I hope you enjoy.